We're working on numerous projects, both clinical, that is on patients, and basic research with cells and other tissues and some animal experiments. The clinical work is involved mainly with neurocognitive dysfunction after heart surgery and other outcome changes and genetic predictors of those outcomes. In addition, we have several projects ongoing, for example, giving fish oil to patients before their heart surgery to see if we can reduce the inflammatory response and reduce the incidence of atrial fibrillation, which is an abnormal heart rhythm, and also reduce the confusion some patients experience after heart surgery. In addition, we always have other protocols ongoing, looking at ways to improve heart function after heart surgery and reduce the complications of the operation. On the basic research side, our laboratory is involved, again, several projects. One we've been working on for the last 20 years or so looks at the microvascular changes in the heart and the brain and other organs, again, mainly in response to heart surgery. There's various trials that have been involved with and will continue to be involved with. One is factor 13 protein, which stabilizes blood clot. So if you give this to patients during heart surgery, they tend to bleed less. And that trial was recently just completed, and we were a major part of that trial. So hopefully new drugs will be developed which can reduce bleeding after heart surgery. And it's well known, if you can reduce bleeding and the amount of blood that's transfused, patients will do much better after the operation. There's a lot of promising developments that are coming around. One is stem cell therapy or cell therapy in general to improve heart function, improve the blood flow going to the heart muscle, especially the patients that can't have another heart operation or another angioplasty. But there are limitations to the efficacy, how effective these therapies are so far. And a lot of investigators, Dr. Quisenberry, myself, and others, are looking at ways to overcome the negative factors that are preventing these therapies from being effective in patients. The development of new drugs to protect the heart, both during surgery and during a heart attack, are new methods that are being developed. Anti-inflammatory agents are being developed, which again can have an effect on not only treating cardiovascular patients, but patients with arthritis and other conditions. If you look back 100 years, diabetes was almost a fatal disease. And we've made great strides in treating diabetes, and now it's still a risk factor for cardiovascular disease, but it's more of an inconvenience than a death sentence. Cardiovascular disease is still very prevalent, and we're controlling the risk factors. And it's our hope that in the future, it will also be more of an inconvenience than a death sentence, and will not require surgery, will not require angioplasty. A lot of these conditions, blockages in the heart arteries, will be able to be treated with drugs. How long will it be before we see these therapies? I think we're seeing some of the benefits already, but I think it's going to be decades before we see some of these therapies become very effective. For example, cell therapy or growth factor therapy to improve heart muscle function. I still think it's maybe 10, 20, 30 years in the future. We'll have to better understand the science behind the therapies, why they don't work in patients, why they do work in a test tube or in laboratory animals, and how we can overcome these negative factors that are preventing these therapies from being effective. I think we're by far the best funded laboratory in the Northeast, and that includes Massachusetts, Maine, New Hampshire, Vermont, Rhode Island, and probably even New York with regard to cardiovascular surgery research. We're continuing to recruit investigators from Boston, so I see great things happening here in Rhode Island.